Hi, I'm Dr. Noelle Cloven. I'm the co-chair of the GOG Foundation Communications Committee, and I'm thrilled to be here today with Dr. Brian Slomovitz to discuss Uterine Cancer Awareness Month that takes place in the month of June.
Great. Thank you, Noel. I'm Dr. Brian Slomovitz. I'm within the GOG Partners Group. I'm the uterine cancer clinical trial lead. And I've also had the great opportunity to work with the IGCS team to be the chair of their Uterine Cancer Awareness Month initiative. So June is Uterine Cancer Awareness Month. Noel, we're excited about it. We needed a month for endometrial cancer, and we've had it. This is actually our fourth year of recognizing June. Peach is the color. So it's really, we're excited about it because as we know, most cancers in general and most that we deal with, ovarian cancer, cervical cancer, the incidence and the mortality due to the disease is going down. But uterine cancer, it's going up, right? So we're seeing more cases. We're seeing more deaths due to this disease. So we really need to raise awareness. We need to do things to really highlight the disease, highlight the earlier symptoms, to talk about prevention and early detection. We need to highlight the better treatment options, and then ultimately the better care for the advanced and recurrent patients and survivorship, of course.
Tell us a little bit. There've been a lot of breakthroughs lately, so a
Yeah.
lot of big changes, and I think they've had an impact on our patients' lives. We're seeing better outcomes. Which clinical trials do you think in particular have shaped the current landscape and the treatment availabilities for our patients with uterine cancer?
Yeah, no, that's a great point. Typically in uterine cancer, we went years and years without having an FDA approval. We had an FDA approval for progestins back in the early 70s, and now more recently we've had a whole slew of FDA approvals. I think the one treatment that really changed the world, was a game changer for us, was incorporating immunotherapy
Right.
into the management of this disease. And now we have first line indications, we have second line indications. So what I like to say is all women who are struggling, fighting with endometrial cancer, sort of deserve an immunotherapy at some course of their treatment.
Exactly. I think that's what we're seeing is we're seeing the treatments being developed for patients first with recurrent cancer, but then we're bringing these into frontline therapies. And I've heard you say this before, you were on our way to maybe even having a chemotherapy-free
Yeah.
treatment option for patients with metastatic or recurrent endometrial cancer.
Yeah, that's exciting. I've always said it's one of my career goals is to
Yeah.
eliminate chemotherapy for this disease. Immunotherapy, there's great opportunity. Even within the second line, we have a chemo-free regimen with lenvatinib, pembrolizumab. And really, that's the question was what have we done to incorporate into standard of care? And then what are we doing to come up with the next standards? And we're really investigating several antibody drug conjugates, which are their chemotherapy, but they're directed chemotherapy. Preliminary evidence shows that they have a great chance of working this disease, and we'll see the results and we'll see the data, but we're excited about continuing to change the standard with some of these newer agents.
So I think what you're talking about, and people hear a lot about targeted therapy,
Yeah.
right? And so this is therapy that might be specific for something that's unique to an individual patient's cancer.
Yeah.
So a lot of those are in clinical trials. What are you most excited about in that, for trials in that,
Yeah.
with that aspect of specifically targeting rather than just treating a broad spectrum?
Yeah, well, actually, some of them are targeting, like we're targeting the HER2
Mhm.
protein. We're targeting another one called B7H4, alpha folate receptor, are just some of the examples. In addition, some of the others are maybe tumor target agnostic, meaning maybe they're all for all of our patients. We'll have to see how that plays out. I think what am I most excited for? We're going to see. I believe that ADCs work in the second line. But just like anything else, we want to bring the better treatments into the first line. And even with the GOG partners, we have an adjuvant trial looking at an antibody drug conjugate. So I think the opportunities there really exist moving into earlier lines of therapy.
So what advice would you give to a woman who's newly diagnosed with endometrial cancer? What sort of what should they be looking for when they're talking to their healthcare provider?
Yeah, we want to make sure they get the right appropriate care.
Mhm.
And in doing so, they should seek out a physician, a gynecologic oncologist whose expertise, whose scope of practice is really limited to working with gynecologic cancers. I think for a newly diagnosed patient, it's important to seek out a gynecologic oncology surgeon who really has the expertise in appropriately managing their care, your care, minimally invasive surgery, whether it be robotic surgery, laparoscopic surgery, what we call sentinel lymph node biopsy. And then moving on for those patients who have recurrent or advanced disease, making sure that they see a seasoned expert who knows the intricacies of the latest lines of therapy, the combination of chemotherapies with immunotherapy, immunotherapy alone. We haven't really talked much about hormonal therapy as another option. So it's really important to get the best care first.
Mhm.
And in order to do that, it's seeking out the appropriate specialist. And if you're unsure, seek out a second opinion. You know, it's that important to make sure you get the best care.
Yeah, and I would just add one final thing. Always ask about clinical trials. Remember, the treatments that patients are receiving today were once a clinical trial themselves, and that's how we've made all of our improvements. And we're changing people's lives, we're transforming care with all of our innovations. So make sure that you find out if there's a clinical trial that might be available for you.
Yeah, Noel, thank you for the comment of talking about the clinical research. One thing that's important that we're all passionate about is understanding that endometrial cancer affects diverse populations. And one of the things that we were always hesitant to say, but we need to say now, Black women with endometrial cancer are twice as likely to die from their disease as white women. So we need to focus on these diverse groups. We need to make sure that they're included appropriately in our clinical trials. Why? We want to make sure that the results of these trials are transferable to all the patients who suffer from this disease. So I think that's extremely important. And just not our Black patients, our Hispanic patients that we treat, Asian patients, the outcomes are different. So we really need to better
Yeah,
study those.
exactly. Yeah, we want the trials to be to be effective in the people who will be using them eventually, and that means all women.
Yeah.
So
So I'm really excited working with the IGCS, working with the GOG, working with you and your team to raise awareness for Uterine Cancer Awareness Month. I think it's crucial that we do this. It's crucial that this initiative is sustainable, making sure we educate our patients, our families, our colleagues, their families, their colleagues. And I know as you know, we always like a social media presence, following
right,
us
right.
and reading more about GOG Foundation on Facebook, Twitter, LinkedIn, Instagram. We'd love to see you there. And any comments or questions, you know, message us, and we're happy to work with you.
Absolutely. Spread the word, increase awareness, make sure you're aware of clinical trials, and follow us for more information.
Great. Thanks.
Okay.
Thanks for having me.
Okay.